Hi, my name is Nick and I'm here to teach you a little bit how to prevent DVTs in our patients. DVTs are deep vein thrombosis, which is caused by inadequate blood flow to the lower extremities. So the first thing I think is ambulation. So get your patient up and walking, a few times a shift at least. They need to be up and walking. It'll stimulate blood flow to your lower extremities. But we also have two other devices here. We have TED hoses, which this is also compressing on the calf and on the just whole lower extremity, and that's also creating blood flow. We also have these compression devices that we put down here, and those are squeezing and letting go. So it's kind of like contracting to bring blood flow up towards the heart. Another thing that we have, we're also going to talk about prevention or preventing ostomy complications. So basically what you need to know here is that you have to have the correct bag size. If you have a size that's too small, you could have feces that accumulate in the bag and then they come up to the ostomy, and you don't want feces touching your ostomy, so there might be complications there with infection. Another thing here is that you have to have the right adhesive size. So let's take this off. So you have to have the right adhesive size. So you don't want any of the feces touching the skin around the ostomy. So the actual skin right here, it can touch the ostomy, but you don't want it to actually touch the skin around it, or else you're going to have excoriation and problems like that. Another thing is you also have to assess the color of the ostomy. So, normal ostomies are going to be bright red. This color right here is orange. If it's white, that's what you don't want. So you have to make sure that you're marking the color, the consistency. Make sure that whenever you're cleaning, you're using water and not alcohol-based products, because those will also irritate the ostomy. And that's just a little bit about how to prevent ostomy complications and how to prevent DVTs in our patients.